you some big news that's just coming in. The United Kingdom Prime Minister Boris Johnson has tested positive for COVID-19. The test was carried out at the Prime Minister's house after he showed symptoms. Boris Johnson continues to lead the government's response to COVID-19. The UK Prime Minister has also received some criticism over UK's response to the outbreak of COVID-19. Now, the Prime Minister has tested positive for COVID-19. He was advised to take a test after he had a few symptoms. He had mild symptoms. He took up the test and now the test results are out. He has tested positive. He might just be the most high-profile case of COVID-19 up until now. Prince Charles had also just 2 days ago confirmed that he has tested positive but remains in good health. Now, Boris Johnson has confirmed positive. This was the advice that England's chief medical officer had given him after he said that he was suffering from mild symptoms. In keeping with their guidance, the Prime Minister is self-isolating in Downing Street. But he continues to lead the government's response to coronavirus. This was the official statement that was issued by the Prime Minister's office.
Hi folks, I want to bring you up to speed with something that's happening today, which is that I've developed mild symptoms of the coronavirus. That's to say, a temperature and a persistent cough. And on the advice of the chief medical officer, I've taken a test that has come out positive. So I am working from home, I'm self-isolating, and that's entirely the right thing to do. But be in no doubt that I can continue, thanks to the wizardry of modern technology, to communicate with all my top team to lead the national fight back against coronavirus. And I want to thank everybody who's involved. I want to thank, of course, above all, our amazing NHS staff. It was very moving last night to join in that national clap for the NHS. But it's not just the NHS, it's our police, our social care workers, teachers, everybody who works in schools, the DWP staff, an amazing national effort by the public services, but also by every member of the British public who's volunteering. Incredible response. 600,000 people have volunteered to take part in a great national effort to protect people from the consequences of coronavirus. I want to thank you. I want to thank everybody who's working to keep our country going through this epidemic. And we will get through it. And the way we're going to get through it is, of course, by applying the measures that you'll have heard so much about. And the more effectively we all comply with those measures, the faster our country will come through this epidemic and the faster we'll bounce back. So thank you to everybody who's doing what I'm doing, working from home to stop the spread of the virus from household to household. That's the way we're going to win. We're going to beat it, and we're going to beat it together. Stay at home, protect the NHS, and save lives.
Right. This was the reaction of the British Prime Minister. We're joined in by Dr. Neeraj Patil, the ex-mayor of Lambyoth. Many thanks for joining us. Dr. Neeraj Patil, firstly, we hope you're doing well. The situation in London in particular and United Kingdom is quite worrying. If you can tell us what the situation is like currently.
The number of COVID-19 cases is going up. Number of deaths are going up. This is along expected line. As we know, we are in the beginning of a pandemic and it's going to go up before it goes down.
Okay, all right. Is United Kingdom in a complete lockdown?
Yes, it is in a state of a complete lockdown because social distancing really helps in the prevention of spread of this disease.
Okay. We've seen visuals, several reports coming in as well that despite the lockdown, there is a lot of crowding. Images that have come forward that show the kind of crowding in public transport systems. Does that mean that the public transport systems are still working? And this is despite the £1,000 fine that the government has said it will impose on people who are violating the lockdown?
Yes, a few days ago, commuters were overcrowded, and Mayor of London, Sadiq Khan, has advised people only to use the tube network and the travel network if necessary. But again, you have to remember there are people who cannot work from home, like me. Okay, doctors, nurses, firemen, police officers cannot work from home. So there are, you have to remember, there are a group of workers who essentially have to go to work, and you need public transport, and they have to use public transport.
Okay, so that's the reason why there is so much crowding. But there is a lot of criticism as well that the UK government has faced over its handling of the outbreak of COVID-19.
No. UK government is handling COVID-19 very well, because the cases are going up along expected lines, and it's going to go up before it goes down.
All right. Also, Dr. Neeraj Patil, there has been talk of herd immunity that the United Kingdom is looking at. That's a criticism it has received, and also something that has been called extremely risky.
No, let me tell you, there is no herd immunity for coronavirus. Okay, you would get a herd immunity only if 60% of the population is either immunized or sensitized to the virus. Okay, so there is no herd immunity for this particular virus.
Okay, so you praised the UK government over the efforts that they have taken. Is there adequate capacity in the hospitals and the medical staff to deal with the crisis?
Yes, because the whole UK government and the NHS is geared up to fight this coronavirus infection. So we are in phase 1, okay? We know we're going to go into phase 2 and phase 3. As we go into phase 3, it is going to get worse. We are taking all the measures in United Kingdom to stop the spread of this disease. Okay, let me explain what is being done. Okay, at 3 levels in any epidemiology or in any pandemic. Okay, you have to counter a pandemic at 3 levels: primary prevention, secondary prevention, and tertiary prevention. Okay, primary prevention. Let me tell you, the infectivity of coronavirus is 1:3. So in other words, one single individual will infect 3 people. So if that goes, say, over 3 months period, you will have 50,000 people. So by social distancing, you make that at least 1:1. So instead of having 50,000 infected people by the end of 3 months, you'll be having only 500.
Okay.
Now, social distancing, so there is no events happening, and people have been advised to stay at home. People who can work from home, they've been encouraged to work from home. These are all the primary prevention measures that have been taking place. Now, as far as secondary prevention is concerned, all the emergency departments and the ITU departments and the respiratory units in the in UK and in the NHS hospitals are geared up to treat COVID patients. Okay, we are already treating COVID patients. We are encouraging them to stay at home and self-isolate themselves and come to the hospital only if they develop serious symptoms. On a tertiary level, yes, the number of ITU beds have increased. The number of intensive care patients, intensive care beds have been increased. So this is done at a tertiary level. So in UK is doing a fantastic job to tackle corona crisis at primary level, secondary level, and a tertiary level.
Okay. India is also taking efforts to battle the pandemic. What are the lessons that India can learn? Because the onset started in UK much earlier. So what is it that India can learn from UK's fight?
So the thing is, I think, India on a primary prevention level, okay, India is doing the right thing by encouraging social distancing,
Mm-hmm.
and they are encouraging people to stay at home, and there is a curfew for the next 21 days. That's the right thing, okay. And in the secondary prevention, I can see the health departments in UK are gearing up to fight COVID-19 disease. And at the tertiary levels also, I have read in the newspaper reports that they are increasing the number of ITU beds all over the country, which is the right thing. And I think India is doing a fantastic job under the leadership of Prime Minister Modi.
Okay. Okay. All right. So, while speaking of UK, what's happening is that there are several volunteers who have come forward as well. While you spoke of what the country is doing, there are several, over 5 lakh volunteers who have come forward to help the medical staff in this fight, isn't it?
Yes, that's a good thing, because remember, we need we need people to help, just simply like, like somebody is suffering from COVID-19 and they are self isolating themselves. Somebody needs to go and give them food. Somebody needs to go and give them medicines. Somebody needs to talk to them, so they can't just be in a solitary confinement. So it's just engaging those people who are suffering from COVID-19 is also very important. And moreover, remember, 90% of the people who get COVID-19 infection do not need hospital admission. They are best treated at their home by social distancing, self isolation, taking simple paracetamols regularly, and drinking plenty of fluid to hydrate themselves, and avoiding contact, especially with elderly people. That's the best thing they can do.
Okay. Okay. So, what next for the United Kingdom? When do you expect the situation to get better? You said the situation will get worse before it gets better. So, what is your estimate? When will things get better?
So all we know is it is going to get worse in the next 2 months, and no one exactly knows when it is going to get better. So I hope that by Christmas everything will be fine.